We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now.
Hello, and welcome to the Health System CXO podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jackie Kimmell, Senior Director of Member Insights at the Health Management Academy, and Strategy Executives host, sharing the latest market trends and essential insights happening across healthcare so that you can chart a strategic path forward for your health system and move quickly and expertly in the right direction. Hello, thanks so much for joining me today for the Healthcare CXO podcast, where we explore the big shifts in healthcare strategy and consider how the market is changing and what you should know as a health system leader. If you're an executive in the healthcare space or just trying to make sense of where healthcare is headed, this episode is for you. Now, I'm going to mention what I'm talking about today, and I don't want you to turn off this podcast immediately, because this is somewhat of a divisive topic that I think many people feel like has been talked about ad nauseum, but really has not changed that much over the course of the last few years, and that is value-based or risk-based payment. So many of you will have the sense that despite talking about this broad shift to value-based care over the course of the last decade or more across health systems, meaningful value-based or risk-based revenue is still exceedingly rare. Across health systems that we survey, we see on average that 95% of all revenue is still tied to fee-for-service payment, meaning less than 5% is tied to risk or value-based payments. And that's really not because of a lack of meaningful efforts on the part of most health systems. Indeed, the average health system has about 190,000 lives tied to risk across their portfolio, be that within ACOs, MSSP, within payer-based contracts, their own provider-sponsored plan, etc. But of that 190,000 lives, 20% of those lives are tied to any form of downside risk, meaning that the rest, the remaining 80%, are really just tied to types of quality-based, upside-only types of payments. Essentially, really not meaningful risk that translates to a large amount of revenue being tied to those risk-based payments. And that's not for lack of trying, as I just said. Most of the health system executives I talk to understand or, feel that the writing is kind of on the wall in terms of the continued longevity of fee-for-service payments within health systems in particular. They understand that, in particular, costs and inflationary costs, workforce costs, etc., are not keeping up with the reimbursement that they are getting from Medicare, from payers, and that is going to continue to worsen with the aging population and a shift specifically to governmental payers. At the same time, they will say that risk and meaningfully shifting the population to risk is very hard. And there's several challenges that are talked about most commonly. Aligning with payers is very challenging. The floor is often always changing in terms of those payer-based contracts. So even if you're saving 10%, the next year you're only left with 90% to work from, which of course is a major challenge financially. And then, there are very few payers in the market even willing to offer risk, let alone to look out 3 to 5 years to help health systems meaningfully on-ramp to taking on that risk, which is so important because it's very challenging getting the system ready for this shift and incentivizing, especially aligning incentives across the health system in a shift to risk and from a physician alignment strategy. Of course, there's also been headwinds this year. We've seen incredibly heightened utilization across both Medicare Advantage and Medicaid in particular, in large part for the latter one due to the high number of redeterminations that have happened since COVID, and for the former one with V28, which has really changed the name of the game in terms of capitated payments. And so in my understanding, we're at kind of this liminal moment where most health systems, I think, are interested in long-term risk, but it's still tremendously rare across a large number of health systems. And that's why I want to frame our conversation today, talking about 3 new models that I think are particularly interesting in terms of health systems making meaningful investment into risk. These 3 that I talk about are not really going to surprise you, but I want you to stick around and listen to hear more from the CSO of Cone Health, Chris Cornue, who actually is going to provide a firsthand perspective of why the system joined Risant Health and give a little bit of background there. So today I want to dive into really briefly 3 of these vehicles that I think are interesting in terms of how systems are trying to build capabilities, and especially the data and infrastructure technology capabilities that they need in order to take on risk in a more meaningful way. First, I'm going to quickly talk about the acquisition of Summa Health by General Catalyst, HATCO. Then I'm going to talk briefly about the new Longitude Health launched by 4 leading health systems, including working on projects like value-based care. And third, I'm going to quickly talk about Risant Health and then turn it over to my interview with Chris Cornue to share a lot more about why they decided to join Risant. So let's go ahead and dive in. And let's start with the Summa Health and HATCO deal. So I think this acquisition took many by surprise because we've never really seen a VC firm make this type of investment directly into a provider asset. It was announced around last year, this acquisition of Akron-based Summa Health, based in Ohio, and many people were just deeply confused why General Catalyst was interested in acquiring a health system. I think there was kind of 2 classes of speculation. One was amongst people who said, all right, this is just a move to try to have a VC firm have a playground for their portfolio companies, kind of like a sandbox, if you will, for them to scale their offerings to try and get measurable results within an active health system, hopefully so that they can, share those measurable results with external partners and potentially find other systems to work with. And that was really driven, I think a lot of that speculation was driven by the fact that a lot of General Catalyst capital is currently locked up because of the lack of exits within the market. And so a lot of their portfolio companies have been with them for a number of years. And, I think trying to provide them that sandbox to work within a system could be a helpful tool for those portfolio companies. But secondly, there was a group of people who said, maybe we're going to be a little more optimistic. Maybe we're going to say that HATCO could be trying to actually meaningfully see how technology could be used to change a health system. Maybe they actually really want to see how technology could enable value-based care and use these new tools to make a difference. That makes sense given some of the leaders of HATCO and where they previously were serving in roles like, Mark Harrison at Intermountain. We now know a lot more details about the deal. So we know that General Catalyst is purchasing Summa for $485 million. They're also assuming all of the health system's debt, and along with their cash on hand will allow Summa to eliminate just about $350 million in debt. HATCO is also pledging to spend $350 million over the next 5 years to support routine operations and technology investments, as well as another $200 million over the next 7 years for, quote, strategic and transformative initiatives. So basically, we know that HATCO is spending a whole lot of money to put into this health system, which I think in my mind kind of rules out the first hypothesis that this is just a play for their portfolio companies. I mean, potentially taking on the debt, potentially taking on, this acquisition was just to enable them to do that. But I think the additional money that they are spending kind of pushes to the idea that they are going to try a new model of care. So I think this one will be interesting to watch over the course of the next few years, and we're going to kind of start to read the tea leaves on what's happening with that acquisition. But the second new model that's come up really quite recently that I think is interesting in terms of health systems working together to try and enable more value-based care is with the launch of Longitude Health, which was launched just last month in October 2024, which is aiming to try and drive innovation, efficiency, and strategic growth across 4 health systems that have come in together: Baylor, Memorial Hermann, Novant, and Providence all coming together to try and address some of their top issues and try and work collaboratively. It's an interesting model. It has 100% ownership by these participating nonprofit health systems, a board of directors comprised by all the member CEOs. It's a nonprofit holding company, and they have the flexibility to invite external capital for subsidiary companies as needed. So, they could introduce the portfolio companies to VC or PE firms to raise future rounds. What's interesting is that all of the CSOs from the member health systems are going to be convening to discuss potential solutions, they say with nothing off limits, and are going to vet through all of the ideas with a rigorous process to try and figure out which one of the top priorities are going to be actually delivered on by Longitude. But what I think I found most interesting is that in a recent report about Longitude, they are saying that they might focus on value-based specialty care. Again, it's still early, so who knows if they actually do so. But they've essentially said that, they've kind of entered value-based care 2.0, they think, where they're not just focused on primary care and trying to, find value-based solutions and risk-based payment models for primary care, but those models have actually been usurped by specialty care first models. And so, maybe a podiatry group could be much more positioned to handle total cost of care for certain populations than even a PCP. And so they're going to continue to try and kind of push forward in this space, potentially with a project specifically focused on value-based specialty care, which I think is going to be an interesting one to watch over the course of the next few years. And finally, we have to talk about the third type of recent news event and market going on that I think pushes to new potential growth of value-based models. And that, of course, is Risant Health. This is another one that I think very much caught people by surprise when it was announced that Risant Health would acquire Geisinger just about a year and a half ago. I think many were surprised that Kaiser was making that move through Risant, that they weren't actually doing the acquisition directly. I'm sure that was for regulatory reasons, but also that they wanted to build this consortium of health systems across the country trying to move into value-based care and, really work together on both building a tech platform, likely very much coming from Kaiser's own tech platform, as well as working on joint care guidelines or clinical guidelines to try and actually lead to meaningful change for those organizations and helping them shift into risk. So things got a little quiet on the Risant front for, almost a year. But then over the summer, we learned who the second partner of Risant would be, and that's Cone Health, based down in North Carolina. We know Cone pretty well, and I was surprised when, that news came out. And so we immediately reached out to the CSO, Chris, who we're going to hear from shortly. But since then, there's been a couple of new details about what Cone's involvement is going to look like in Risant with some financial filings that came out from Kaiser. So we know that Kaiser is going to make $1 billion of capital available to Cone as it transitions into Risant for the first 5 years, and then we'll add up to $400 billion to support Cone's integration into Risant, as well as $300 billion for growth over the next 10 years. That's all really with this overarching goal, as Kaiser Chair and CEO Greg A. Adams told attendees recently at Health, that it's looking to pull in 5 to 6 organizations over the next several years, which are, in altogether looking to achieve total revenue between 30 to 35 billion. So actually really competing in size with some of the largest health systems in the country as that consortium. Now, the choice of Cone I thought was very interesting because we've heard rumors over the course of the last year and a half or so of who these other potential partners of Risant would be. And I think many of the names that were thrown out were systems that were really struggling financially and have struggled in value-based care. And, the thought was, well, they're going to have to sell to Risant because they don't have much financial runway yet. But I think the Cone acquisition shows that is really not the case. And a lot of that speculation about this really being a vehicle to bail out financially strapped organizations is not what is happening here. In fact, I think Risant has been very clear that they are trying to pull in organizations that are committed to value-based care, specifically are leaders in their community and financially sound, but just haven't been able to make that full-scale transformation without the technology and the value-based know-how. And so really supporting them with that change management approach. As you'll hear from Chris, I think what really appealed to Cone was access to what Risant is building in a technological platform and building this kind of tech-based, value-based care platform that will allow both their aligned and employed physicians to really tap into some of these best-in-class tools. The other quite interesting thing that has come out recently around Risant is we've started to learn a little more about what Risant has been able to do in terms of cost improvements for Geisinger. So Greg Adams shared a little more of what they're trying to do in terms of improving the system's cost structure. They said that they're trying to make a number of changes to conservatively improve the system's cost structure by 2 to 3%. Now, the majority of that is coming from cost reduction, but the rest, around 40%, is actually related to creating shared services across the enterprise. So Geisinger has already seen around a 1% improvement on their cost structure or margin within the first 6 months of the partnership. And they're actually now looking on rolling out 200 primary care guidelines formed with the collective experience of several health systems, including those who will ultimately become eventual partners of Risant. So why did Chris actually decide to move forward, and why did Cone decide to move forward with this Risant model? With that, I would love to shift over to my interview with him to share more about Risant and why Cone decided to be involved. So Chris, how did this deal come together? Did you approach Risant or did they approach you?
In the spring of 2023, when we saw the announcement about Geisinger coming into Risant, we were very excited and believed this aligned exactly with our current and future strategy focus at Cone Health. Through some connections, I reached out and we were able to get an initial conversation for Dr. Mary Jo Cagle, Cone Health's CEO, with Greg Adams, the chair and CEO of Kaiser Foundation Health Plan and Hospitals. That culminated in a meeting at the end of June 2023, and from that point through the end of June of this year, we were on a 12 to 13 month process of evaluating what this partnership could look like. I have to say, from the very first meeting that Mary Jo and I had with Greg, it was clear we are two very similar organizations focused on mission, a true love for creating healthier communities, and also on this journey towards value-based care. Cone Health is a very strong, stable organization, and over the last 12 to 13 years, we've really been trying to double down on value-based care. Our Strategic Vision 2030, which we finished up earlier this year, is very much driven by that value-based care philosophy.
We've heard that the strengths of your value-based care network and your health plan were major factors in Risant Health being interested in you. So tell us, what competencies do you think they're looking for?
But I would say first, they're essentially looking for strong financial organizations. They're not just looking for a strong bottom line this year or over the last 10 years. They're projecting with a model several decades ahead and will ensure that there is a strong financial path forward. It's definitely a long-term play. Second, they're looking for an organization that's in the right markets, that can grow from a value-based care perspective. Think about North Carolina. There's a lot of growth, and there are some areas of value-based care, but not a whole lot across the state. In our region, Cone Health has been focused on creating higher quality and lower cost care, and also engaging physicians with a pluralistic model. That makes a really nice basis for a longer-term future around value-based care.
So will Kaiser Permanente or Risant require a certain share of your revenue to be value-based by some point?
No, not at this point. It's not something they've talked about as a requirement. We know we need to be a financially strong organization and determine the right balance between value-based care and fee-for-service. We need to be thinking about what that looks like from a financial modeling perspective as well.
We've heard that Risant's technological capabilities are a major selling point. Can you share more?
KP has spent decades perfecting an approach that works really well for their respective markets. With their decision to create Risant, KP recognized that they're able to move faster from a technology perspective because of the amount of capital and infrastructure that they already have in place. So they bring to the table a developing platform that helps organizations to be more thoughtful in their approach to value-based care. It's AHR agnostic, and it allows for a deeper emphasis on evidence-based care. It also allows for different engagement opportunities with consumers and reduces some of the administrative burden that physicians face every day.
With those aligned physicians, especially, what does change management look like? How has the internal reaction been thus far?
But with the internal and external messaging we've done so far, I'd say 99% of the reactions have been very positive, exciting, and full of possibility. When we started this process, we brought in 14 physicians from different specialties: primary care, OBGYN, GI, oncology, cardiovascular, hospitalists, pulmonary, and they were both employed and independent. And we did this to evaluate the Risant model from a clinical perspective. In the end, all of them were incredibly supportive of Risant and have willingly become ambassadors with their respective physician groups. There's also a lot of excitement that we're the second system to join Risant after Geisinger. There's a lot of value in being able to shape what this looks like with our pluralistic approach to physicians, employed and affiliated, in a new market and co-create the future organization.
How will governance work? I know that Cone Health will remain independent and have its own CEO and board, but how will the system coordinate with Risant?
We will have a seat on the Risant board, and there will be a couple Risant board members on the Cone Health board. So that's one way we're staying in sync. There will also be councils and ways for several individuals across Cone Health to be involved with co-creating Risant with our sister systems like Geisinger. That's another way that we're making sure that we stay connected and in sync. One of the reasons they set it up the way they did is because we know our markets and communities very well. We know how to channel value-based care in North Carolina, which is part of the secret sauce, how we can link everything together through Risant so we're moving toward the world of value-based care, but also informing it based upon what we know needs to take place locally within our own region.
How is this shaping your strategic plan and how you differentiate in the market?
We have two jobs now. Not only are we responsible for Cone Health, we are also responsible for making sure that Risant is successful. And that's really exciting. Ultimately, our path for Cone Health would be in place and shaped by our 2030 strategic vision, regardless of Risant Health. However, our partnership with them allows for us to accelerate this work faster. Success comes down to how you differentiate yourself in the market. And I think value-based care is a very unique differentiator for us. It's also unique in the way we work with our workforce. We would be doing this regardless of Risant, but now we can do it even faster and more intentionally going forward.
What advice would you give to other CSO strategy leaders? Who should consider this model?
For organizations that have started the journey around value-based care and are truly committed to it, this is definitely worth a look. The right fit would be an organization that's committed to value and has some experience in it. If there's a commitment to differentiate yourself around a value-based care future, a commitment to quality over cost, investing in the associated infrastructure, and connecting different parts of the organization, then I would say this is something to look at. Going back to my pre-med days, I'd say this is a true mutualistic symbiotic relationship. We have some great strengths that we can infuse into Risant as they evolve, and we will gain from 80 years of KP's journey around value and community-based care that will only make us better and stronger. And with Geisinger and other similar organizations that join, we have a tremendous opportunity to learn from each other. Bottom line is we continue to honor our respective mission-based journeys of 71 years for Cone Health and 80 years for KP through what we're now creating together.
As a final question, has there been anything surprising or unexpected about this process for you?
First, I would answer that this is probably the most unique strategic partnership that I've seen in my 30 years in healthcare. We've all seen lots of transactions. I've been in the seat where I've created strategic combinations similar to this in the past. But the reason that we are so excited about this, it is so unique and so tied to who we are as an organization. This isn't the type of transaction where everyone ends up reporting into another health system or to another board somewhere. It's not a merger or acquisition type of play to where you're aggregating resources or you're merging capital and deferring decision making to others in another state. It's none of those things. 3 years ago, we were in the throes of a merger with another health system. That didn't work. But during the course of the conversations over the past 13 months, I can't think of a time when there was anything that we talked about or learned about Risant that gave us pause. KP spends time evaluating future possible states that they believe are grounded in a future base care world. They're not controlling it necessarily, but they have developed a different type of model that creates an intentional and impactful way to evolve healthcare towards that future state. By bringing together like-minded organizations that can collaborate, share, and implement proven approaches that drive this in their respective regional markets, I believe you truly can shape a different future for healthcare in America.
Thanks so much, Chris. Really appreciate your time and willingness to share more. Thank you for joining me on the Health System CXO podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health System CXO podcast on your favorite podcast platform so that you never miss an opportunity for insights. If you liked this episode, consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.